projects and goals that we have. Number one, as I said, is awareness. Awareness in several medias, several forms. We've already done programs with IIT, Lila College, and not just awareness among persons we talk to. Socrates has said that education is not filling a vessel but stoking a flame. Our goal is to stoke a flame. Talk about prostate cancer. If each one of you can talk about prostate cancer to one other person, I think our goal of this inauguration has been met. Now, and again, as I said, we need a proper support group, and this support group will, in effect, help a lot of patients with prostate cancer. And the website, website as a resource. If patients develop CA prostate or symptoms suggest of CA prostate, what we've done is we've got a website which will be a one-stop shop for prostate cancer. Anything to do with it, rehabilitation, Kegels exercises, where to get diapers, how much do they cost, and so on. So we would like it to be a one-stop area for all resources regarding prostate cancer. And the next is counselors. So this is again, there's a big deficit between what patients need and what we can offer with the limited amount of time that we have. So if they can call up a number and ask all their doubts regarding prostate cancer, and which will be answered in a reasonably good way, I think we'll meet our goals here. So again, we're planning to have counselors in the foundation, and they can be called from 8 to 5 any day to ask any doubt about prostate cancer. Where is the best treatment? What is the best treatment? How do we proceed from here onwards? In a reasonably good way, so that we're not trying to replace doctors, but we're trying to bridge the gap between what patients know and what they need. Research, guidelines, and finally about a project that's close to my heart as well, protecting the men that are protecting us. So we're planning to do a project with the armed forces, where we're trying to offer these prostate checks for the entire armed forces in the southern region free of cost. So these are the projects, these are the goals of the foundation. Some of the seed thoughts I've already told you. But before I finish, I'd like to bring you to a month ago, where Chennai was ravaged by floods, lashed by rains. Stories of untold suffering. But in all that, one thing that stood out was how much the people came out and helped each other. You had strangers helping strangers. You had students coming out of colleges to help people. You had so much outpouring of support for the people who were struck down. Ladies and gentlemen, this is another flood. The prostate cancer is a flood. It's a much more insidious flood. You don't see water gushing up, but you have to sit up and take notice. If we do not take notice, then we are in trouble. And this is one message that I want all of you to take home. Prostate cancer, if detected early, is definitely curable. And I urge you all to join us in this fight against cancer. Thank you.
I thank you, sir, for briefing us about prostate cancer and how the Indian Prostate Cancer Foundation can make a positive difference to everyone. Dr. Chinnasamy is one of the first urologists of our country and a doyen in the field of urology, who has trained several successful urologists for more than 5 decades. I request him to kindly release the brochure of the Indian Prostate Cancer Foundation. I request the Tamil Nadu Health Secretary, Dr. Radhakrishnan, to kindly come on the dais and receive the first copy of the brochure. Now Dr. Chinnasamy will speak now. Thank you, sir. I now request Dr. Chinnasamy to share a few words with us.
Ladies and gentlemen, it's indeed a great honor to have been invited by Dr. Radhakrishnan and Sivaraman to be associated with this great function. Cancer prostate seems to be the biggest killer of male members in Western countries. We have been very complacent thinking that this disease does not exist in our country, very wrongly. I know the past 50 years of urological practice, the incidence of cancer of the prostate is rising, and I am very glad that Radhakrishnan has come up with modern methods of treatment, and I am very happy to see his goals to increase the awareness and also to propagate or make people understand the various methods of treatment. And I am sure we will make a breakthrough, make people understand that cancer of the prostate is curable if detected early, and I am sure this foundation will help in this way. Thank you.
Thank you, sir, for your blessings. The past 2 months saw the entire state reeling from the disaster of heavy rains. The worst was dreaded, and an epidemic outbreak of various diseases was predicted. Much to everyone's surprise and relief, such an outbreak was curbed thanks to the effort of our State Health Secretary, Dr. Radhakrishnan. Immediate measures to vaccinate people and elaborate cleaning efforts has helped the city bounce back to normalcy. Such is the power of the government's reach. With support from them, the Indian Prostate Cancer Foundation believes it can help more people who have prostate cancer. We are humbled by the presence of Dr. Radhakrishnan despite his busy schedule. I request you, sir, to kindly address the gathering.
Good evening, everybody. Senior Justices, Dr. Pratap C. Reddy Doyen of bringing in the state-of-art healthcare, other distinguished doctors, Dr. Sampath sir, and other dignitaries who have come here, and especially the entire team which has launched this Indian Prostate Cancer Foundation. I'm extremely delighted to be here. First, I would like to correct one message when she said that, it was basically because of, it is because of all of us that, we all joined together after this devastating floods, and especially the coordinated action which not only government but also people like you all joined together. And especially I would like to place on record the thanks to innumerable doctors, nurses, paramedical staffs who have so far conducted roughly around 73,000 camps in streets and bylanes, which was basically instrumental in the government's efforts to ensure that there was no outbreak so far. Of course, we are still keeping our fingers crossed. So I start by thanking the entire fraternity here and the people of Chennai for having cooperated and participated in this entire exercise after the sad floods. And I hope that we have a wonderful new year. Coming to this particular function, I am very happy that on this last day of this year we are coming for this wonderful function where you have started this Cancer Foundation. Our goal, as far as you would have seen Honorable Chief Minister when she talks of Vision 2023, or for that matter any of our aspirations, has been that we should excel, at least attain, if not excel, what developed countries have achieved. So we have two issues. One is preventable communicable diseases and non-communicable diseases. Again, incommunicable vaccine preventable diseases and other diseases which do not have vaccine but can be controlled. But non-communicable disease burden is something which has been bothering everybody. everybody, and silently and unknown to everybody. You have one dengue issue, it becomes a news, but unknown to us, whether it is cardiac issue or prostate cancer, or commonly we are now quite aware of breast cancer, cervical cancer, or other forms of cancer, or for that matter lighter things, blood pressure, sugar, everything. This non-communicable burden is something which we need to tackle. That is precisely where this Indian Prostate Cancer Foundation is coming in a very important way. As far as the statistics was there, 80% in India, we are now coming to the doctor by the time when it is beyond curable level. So that is where I think this foundation will be very useful to join with our efforts as far as the state of Tamil Nadu is concerned. So from our government side, I would like to welcome your effort and also say that we would open our system up to the PHC level. Already we have a very extensive non-communicable diseases program where everybody is tested opportunistically. If he comes to a PHC, he is tested for cervical cancer, breast cancer, and sugar, diabetes, and BP. But we ourselves are very keen that this has to be expanded to oral cancer, prostate cancer, those kinds of things. And here the expertise of the urologists, the entire team which has joined together, is going to be very useful for us. Already Tamil Nadu has been termed a leader as far as cadaver transplant is concerned, or for that matter for medical tourism we are the leader. State of healthcare, we are one of the forerunners in India, and I am sure that as far as tackling such an important issue for men, and many of us who tend to ignore and come very late to the doctor, this foundation will be very instrumental in driving home the point of not only creating awareness but taking them to an appropriate doctor and ensuring that people get cured and live a cancer-free life. Thanks for the entire community which has joined together, because it is deeply impressive that being a New Year Eve, all of us are joining towards this wonderful goal which this foundation has dedicated itself to. I wish the foundation all the best, and I promise all the cooperation from the government side which we could do so that we can take our goal of making our place happier together. Thank you one and all, and wish you all a very happy New Year.
Thank you, sir. Dr. P.C. Reddy is the chairman of Apollo Hospital and a pioneer in the healthcare industry, and more importantly, a great human being. I now request you, sir, to inaugurate the Indian Prostate Cancer Foundation website and share a few words with us.
Good evening. After hearing Dynamic Health Secretary, what and how the government and the private work together on such a great, furious tragedy that we face, and the continuing of stopping so-called post-fury, I think is very, very important. I compliment the government for its various efforts to bring all of us together in that sad 10 days. Today I am very happy that Radhakrishnan, who has been one of our pioneers in developing robotic prostatic surgery, has gone the next step to invite his friends and colleagues from across, from US, Vipin Patel, from UK, and his friends within the country who are leaders in prostatic surgery, to form this foundation so that people awareness improves. And then I don't know how many of you remember, in the same hall 2 years ago Apollo conducted what's called Cancer Conclave. The object of Cancer Conclave was the word cancer is a death sentence. How do we convert that and say cancer is conquerable? And this is where I think they would prepare a paper and submit it to the state and the central governments. we need a lot of work to do, and I think this is a great step. I remember about prostatic cancer when the test came, PSA, about 12, 14 years ago. We introduced it in all our checkups. For a whole year, we didn't get a single positive. Then I said, what's wrong? Is this wrong? Is something wrong? And we found that most of the people who are coming for checkups were, the age of 50s. But then first case that we had was a senior government official, and that was positive. At that time, the prostatic surgery in India has not developed. So he opted to go abroad, but unfortunately he had a complication with the surgery. But then came the radiation, followed by cyberknife. That's how we bought cyberknife for Chennai, saying that this is the instrument to eradicate or cure cancer prostate. But I'm happy we have today, and India proudly says that we have today an ongoing robotic prostatic surgery program. For that we are very thankful to Vertiquity Foundation, and more importantly Vipin Patel, who has steered several centers across the country to enable so that we get the technology. And then Radhakrishnan, part of the team, has excelled. I would say he has become the grandmaster of robotic prostatic surgery. What I am very proud of him is, it's not his doing alone. He is assisting all others who are interested in robotic surgery, so that we are able to use this not just for prostate, we are using it for gynecological procedures. I just saw our colorectal surgeon. He has already used for more than 50% of the cases. He has done the robotic surgery. This again, I'm sure Radhakrishnan gave a great help in helping them to get into the robotic. I think time has come, because we have always believed that Indian doctors are second to none. Even anywhere you say, you look at London, the NHS is managed by Indians. If you look at US, I know more than 60,000 leading doctors, Indian doctors, are practicing in US. So around the world we had the skill. What was needed was this backup. First the technology, second is the training on the technology. Today I'm happy that at least 16 centers, I believe, have robotic surgery in the country. When the prices come down, I'm sure we'll have 160 countries. I know when we first bought the robot, very few people thought people can afford it. So I think as times moved on, our surgical outcomes became better. People are convinced. Sometimes they are asking us, can we have robotic surgery? So I think it's time has come to say that in India too, we're gearing up ourselves to match the international standards. That's our goal. Whatever we do, we must be able, because people who walk into us, they believe that we will give outstanding outcomes. And I'm sure, given the set of doctors and the way they work together in bringing the technology, not only in cancer, but in many other diseases, our secretary has mentioned the efforts on NC.